When Boulder saw a rise in fentanyl overdoses, Boulder Valley School District wanted to be ready.
So it's really just another tool in our toolkit to have on hand for emergencies.
Jordan Godo is the district's health and wellness coordinator. That tool she's talking about
and then also, call 911.
is Naloxone, a medicine that quickly reverses the effects of an overdose. All of their schools now have it on hand.
It was really a response to what was happening in the outer community, but also because the folks who were experiencing the overdoses were so young. While they were not our students, we felt that we needed to have this on hand.
And they got it for free from the state health department's Naloxone Bulk Purchase Fund. They're just one of 4 school districts in the state that have it right now. Districts have to submit a policy that shows they're trained to use it. In the case of Boulder Valley, each school has an emergency response team that has access to it.
So those look a little bit different depending on which building it is. Sometimes they're teachers, sometimes they're coaches and administration, as well as all of our nurses that serve all of our schools.
BVSD has used the medicine once since November when someone was showing signs and symptoms of an overdose on a school day.
And so we did deploy the use of Narcan or Naloxone. Fortunately for that person, it was not an overdose, so there was no harm to the person.
Protection not only for those at school, but guests and visitors too.
To reduce the risk of an overdose or a death, I think that's our duty as not only school professionals, but as a community as a whole.
And it's not just schools that have access to this. Rec centers, shopping centers, and other places of work can actually apply for the state's program. But those public places have to also have a defibrillator, on hand. Kyle, there's 178 school districts in the entire state, so this is obviously a very small number actually using this. I asked that tonight, and CDPHE told me that they're trying to reach out to those school districts and are expecting more to sign up before the end of the school year.
I think we're used to seeing all kinds of different life-saving equipment in places like schools and, houses of worship and shopping centers and that sort of thing. This is just one more.
Absolutely. And, I started asking about this story back in December. CDPHE then noted that there was increased interest among schools back when they started returning from the pandemic and returning to learning in person. So we'll have to see how this goes down the line.
Luis De Leon reporting. Thank you, Luis.